Okay, with that, I'd like to call the meeting to order with Pledge of Allegiance.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Roll call, please.
I will go in alphabetical order. Mr. Jack W. Balch,
Present.
Mr. Kevin Holm,
Here.
Mr. Al Hueso,
Here.
Mr. Jack Rogers,
Here.
Mr. Craig Steckler.
Present.
There are no oral or written communications at this time.
Thank you. Bob, would you like to give us a report, please? Oh, wait, I crossed right up, better put my glasses on. Well, would you sit down while we approve the minutes, please?
I move approval of minutes.
Second.
Anybody opposed? Vote. Then it's approved. Thank you.
The first slide, please. On the schedule, the main thing to call your attention to is that you'll see the blue status line coming down the page, and that represents the timeline where we are right now as of July 18th. As we know, we've achieved the staff and stock, and contract substantial completion was actually achieved, even though the schedule's at the end of May. We're talking about live time today was achieved on the 8th of June. We anticipate our open house, which has been granted by OSPOD to have for the hospital, and that's September 13th, as Ed pointed out during our tour. We hope to achieve OSPOD's approval on or before the first week in October. At that point, that's a stepping stone for licensing then to come in and do their thing. Now, we're making those arrangements ahead of time. The hospital already had contact with licensing and everything else. So there's some confidence, not a guarantee, but there's some confidence that the time period between OSPOD's official sign-off and sending it over to licensing, and licensing granting use of the hospital, heads on beds, as everybody calls it, to be a short period of time, and October 10th is an achievable date. That is our goal. We still have a few things to satisfy for OSPOD to achieve those goals. Those are those two connectors that were looked at the end of our tour. One being the main connector for the public, and then the other connector over by the loading dock, which is for patient care and also facilitating the hospital with supplies and going through that area. Right now, those will be the last things that will get finished. We already have the exterior of the building satisfied from OSPOD for use. The existing work that's going on there now is additional work that's actually more in the jurisdiction of the city of Fremont than it is the hospital. So we feel pretty confident that we're going to achieve our goals. Any questions on the? Okay. On the first slide, there's the cumulative cash flow. The green line is the budget cumulative adjusted cash flow. The contract right now for R&S is $249 million some change. It's a hair under 250. And the invoice right now, as you can see, is very close to matching out and achieving the target. And the following slide is the monthly budget versus invoice. And as you can see, there's very little left for for the months of June, July, August, and September, and we're obviously going to be able to finish the project on time and on budget.
You probably should say that as Bob said, we're confident with our timeframes that we have now. The only thing that is a little bit different and showed on the schedule is the loading dock is getting the corridor fixed, putting in the new loading dock will be done on time with the opening of the building. There's then a upgrade of the existing loading dock, some work there, and then there's another bioswale we have to put in, and that will probably go beyond the October date. They'll probably still be working on that. So we'll open, be functional, and that'll be sort of mopping up some work that has to be done. So I wouldn't be surprised right now if we have Rudolph and Sletton on site through December, with them being probably totally done and off-site in first week in January, something like that.
Where that point's at, thanks Ed for doing that, and it's all been in concert and agreement with OSHPD, our schedule and completion of those areas after occupancy. So it's not something that we're wishing for, it's something that's been agreed to.
And you say the connector is upgraded. That's allowed under the bond, the original bond authorization.
Yes,
Okay.
yes.
And
All those things are original scope. They're not changes.
Good. They're just changes in work, not changes to bond description.
Right.
So just a question on the dates.
Yeah.
And on the agencies that are responsible for
Yes.
turning the green light, giving us a green light. So it's OSHPD and the city of Fremont.
City of Fremont, very minor. It's OSHPD, and then after OSHPD gives us a green light, we have something called CDPH, which is the California Department of Public Health. They come through for a licensing survey, and they have to look at you and then grant you that your beds are licensed to operate. And we have to have that before we can run the facility. So OSHPD signs off on the building, says you're done, everything's complete.
But that will happen before the 18th of October, or the 10th, whatever the date is.
That is the plan. The only quote-unquote wild cards on it is you have to schedule them and get them in. And they schedule through Sacramento. Now, to work with them on this, we actually went to Richmond, which is where our local CDPH office is, and have gone through our whole project with them and presented it to them so that they are aware of it, prepped, and actually are working as our advocate. So we have to contact Sacramento to schedule Richmond to come here. And so we're turning over the paperwork for that as we speak.
Oh, okay, so, okay, and then they come up with a report, and they may have changes, but they also can give you the green light. But they're the ultimate
They are.
authority.
So and we have to have them out here, by the way, for anything we do. Let's say we did a renovation of a floor. Before we can move patients in there, they have to come out, and they go over everything from your staffing plans to your policies and procedures. Even though they're out for construction, they basically take what OSHPD has and say, okay, your construction's fine. Now you've got everything in place necessary to run it. And when they're done with the survey, the expected outcome is that for them to say, okay, you can move in, and you can literally, as they walk out the door, you can move in. But they can also say there's an issue, and then they'll have to come back for another survey.
So, as I read this chart,
Yes.
it shows a whole series of things that are happening, ending in the second quarter. It says finish dates in here, June 11th of 18, June 11th, et cetera, down through that section.
Yes.
So, are all of these completed, or are some of them still pending, even though they're marked complete,
That was the
finished
previous
on the
slide.
chart?
Yeah. So the big one is the
The blue
substantial
line is work that's
completion.
completed.
Yeah.
The which?
The blue horizontal line those work activity lines show when they're completed.
Yeah. So to answer your
When it
question,
extends red, it means there's still some work left
I
to
see.
do beyond today.
Yeah, so basically, the reason I'm asking is that I thought you said that we still had, what is OSHPD or whatever, however you pronounce that, an acronym.
yeah.
Finals. Have we completed the final on that, or is there still work to be done on that?
So what we've completed is substantial completion.
Gotcha.
And there is a final completion that has to be done.
That's where I'm confused.
Yes, so they come in, they go through the entire building, and they gave us substantial completion, which is important because then that allows something called staff and stock, which means we can start moving people in, we can start moving furniture in, we can start training people.
You just
and-
can't put patients in yet.
That's correct. And so we need, the final completion is the last thing we need to hand over to licensing for them to come.
Licensing goes to another inspection.
Yes,
Yeah.
yes. So,
So until we have those 2 quarters done, we can't call for final, even though the building itself is done.
Is final, yeah.
Yeah.
I understand. Okay. Thank you.
Any other questions?
On the financial side,
yep.
it looks like at this point, you guys are well behind the budget in invoices processed, but when I look at the next page, it looks like for the last quarter, invoicing has far exceeded budget. So my question is, do you think that pattern will continue, and will the invoicing line eventually meet or exceed the budget line?
Well, it'll meet, there's still other change orders that we have to issue to them. That's in the phase and working that has not been implemented because they're not signed change orders.
Okay. So I guess the heart of my question is, if you look at, I guess this chart, the one that's red-green bar chart,
Yes.
if you look at the last quarter, you see that the red invoicing
Next.
is much, far exceeds the budget. If you look at the page just before it, you show that your invoicing is well below your budget. So it looks to me like at the end of this project, you're getting a lot more invoicing than you have budgeted funds during that particular quarter. Overall, it looks like you're fine, but
And that's also, it takes into play the retention billings and stuff.
okay. Yeah.
So you're right, Jack. You can see since, approximately December of 2016, their billings were less.
Yeah, they were way under.
That's
under
correct.
billings, but
So
now it looks like they're doing
they're
catch-up.
catching up. That's exactly
Yeah.
right. Yes.
The hospital budget for the maintenance of this new building. Now, once it's completed, you're in it, you now have a maintenance issue
Yes.
that's ongoing. What's the budget for that?
Well, that's a totally separate budget. It's an operating budget, and we just finished our first operating budget. So I'm kind of hard pressed to come up with an exact dollar amount. I can tell you that we budgeted, in particular, increases in engineering. I think we have at least 4 additional engineering personnel. We budgeted additional housekeeping people to the tune of, it's at least 15 additional people. And then we have transporters that are going to be moving. So those all happened. There's a whole bunch, there's obviously nurses and radiology techs and all those types of things. But remember, we're closing down departments in the main hospital and then opening up new departments. So those people are being transferred over. And then there is some, we don't budget based on square footage, we budget based on activity level. So we're budgeted based on the number of patients, and we did anticipate an increase in the number of patients, for instance, in the emergency room. I think we anticipated a 10% increase for the year.
About a 6% increase for the
Okay.
year.
So we started it lower and then increased it to about 10%. So over the whole year, it was like 6. And so then the staffing gets increased in the budget to take care of that increase. If we experience greater than that, then our budgets will be low and we'll have to flex up to it. So,
Your income will also go up.
yeah. Pardon me?
Your utilities and the,
Yes, well, good
Ongoing
point.
maintenance?
Yes, so we did, we made projections of what our utilities were going to be based on, we had some experience in the last year as the building came online and we started using different utilities, so we had some experience we utilized. But yes, we had to increase gas and electrical and all that stuff. It's not inconsiderate. It's a substantial amount of money. It's in the millions of dollars. So yeah, the increase in costs are substantial, and really the biggest hits for us on our income going forward is actually in areas that are non-cash expenses, depreciation and interest. Those are really big hits that are going to hit the hospital's income statement and make a considerable dent in our profitability and our bottom line. There's no question about it. Those are far greater than the daily operating expenses, actually. But the daily operating expenses are not minor. We're talking about, just off the top of my head that I spoke to, that's 30 people. And then the utilities you talk about runs in the millions. So it's not a chump change we're talking about in terms of increased costs. It is significant.
But that does not enter into, those costs don't enter into the decisions that we get to.
That's correct. Those are all operating costs that go to the board on a monthly basis, and as does the budget.
Right. Okay, any more questions, or can we have Ray come up and give us some more information on money, I'm sure.
Okay, we have the dashboard up on the screen. There's going to be one thing that is different than you've ever seen it, one indicator different than we've seen it at any time during the project. Anybody got an idea which one that is? The percent earned has always been ahead of the elapsed time until this report. It's at 94 and the project elapsed time is at 99, 3 days before the actual substantial completion date. So obviously the difference between those is that we have a punch list that the contractor's got to still complete, not a substantial one, but some work. We have the change order work that has to be completed, not a substantial amount. It's probably $8 or $10 million total, and half of that or more is done already, but that's still got to be done. So we're essentially on a two-track schedule. The main track is to get the building open and operating, and the second track is to finish up the incidental site work and the loading dock and the plaza canopy and things like that. But pretty much everything is on track with the schedule. The contract amount up there at the top, it shows that it says approved change orders. Now some of the sharp accounting folks are going to pick up the difference between the approved change orders up at the top, the 11.6, and the approved change orders at the bottom, the 13.6. And I knew I would get picked up on that one. The reason for that is very simple. I want to talk a little bit more about change orders because I knew there were a few questions about the change orders in the budget and so forth. I wanted to touch on that. The reason those are different is the top section is purely pulled off the contractor's payout. So we get the most current information or the most accurate information that he has. There's always a lag, though, in his change orders from the one you see at the bottom. The one down at the bottom where it says change order status, that's the ones that the CM is preparing and moving along and getting the owner's signature on. So those are going to generally be ahead of what the contractor has got and put into his payout. And that's why there's the difference there. I thought it'd be useful, though, to talk about the difference between that lower box. We show the requested changes of 15.5, the approved of 13.6, and the pending of 1.9, and compare that to where we were last at the end of the previous period. The requested amount has only been 1.8 million in the last 3-month period. The approved has been 6 million. And that's rather substantial because back in February, the approved was it was 7 million, and so we've added 6 million to that. That was a substantial amount of change orders that were processed in that time period. And therefore, the pending amount dropped substantially. It was dropped by 4.4 million, the difference there. So the change orders are being worked off and will be added, brought into the construction contract as we get to the end. Any questions on the overall budget situation or the? I think we're heading for completion pretty much within our budget, and there are still some things that have to be done, and as Ed mentioned, there are things that you find out about that have to be taken care of to meet the licensing and the OSHPD, both agencies. So we no doubt will continue to have some of those things that come up as we get near the end, but hopefully they'll be fairly minor in cost.
Thank you. Any other thoughts, Mr. Graves?
I think I believe that the largest of those unanticipated changes has to do with this thing that you mentioned, with ligature changes. Will that be able to be absorbed within the budget and stay under budget, or is that going to drive you over budget, making those changes? The legislation that now is requiring you to redo some of the emergency room.
Ed probably could speak to that better than I could, but my gut feeling is those things are fairly minor in the big picture.
Okay.
Having to change 3 rooms because of a new requirement or something, they're going to be change orders, but not a substantial magnitude, no. So.
Yeah, I'm trying to,
I don't need the main number. I just want to know whether it's going to move us outside of budget, and you got to start thinking about that, or if you're still in budget.
Yeah.
If you're in budget, that's
yes,
fine.
right now, we are tallying everything that we know of. This is always a little bit tricky because we don't, as you move along between today and when we met 3 months ago, there's been submittal of, over $1 million of change orders just in that 3-month period of time. So we don't have everything finalized yet,
Yeah.
but where we sit today, it looks like we have enough to cover everything, including the anti-ligature stuff. Yes.
I
And
think Dan will expand a little bit more on that too, so. Thank you. Nope.
Thank you.
Okay. Going to move to the project funding slide. Thank you. Okay, so just kind of revisiting, this is the project funding through May 31st. Again, start off with our project budget at $353,683,000. Expenditures as of the last time we met, which I believe was through February, we're at $293,349,000, almost $350,000. And expenditures during this current period ending May 31st of about almost $11.8 million. And again, still the construction spend is still leading the way here. But as you can see, equipment is starting to pick up as well in this period. This brings us to total expenditures through May 31st of about $305 million, with a variance of about $48.6 million. And of that amount, $291,983,000 were reimbursed through general obligation bonds. Looking at the project cost to completion. Starting with our budget and our total expenditures that I just mentioned of $305 million. The estimate to complete at about $44.8 million. As you can see, the equipment becomes the big spend there at $23.2 million, and as construction starts to fall back a little bit. This brings us to total estimated cost of completion at $349,969,000, and the positive variance of $3,714,958 as of May 31st.
I'd like to go back just for a minute to Jack's question, just so I can give you sort of an illustration of where we're at or how things are going. So, since in the last period, since our last meeting, we had $1.9 million of change orders that were submitted to us. Of that, $1.2 million of it was the work in the back 40 that you saw today that includes bioswales, putting down grasses, sprinklers, drainage, things like that. That was in the original contract. That was not in, that was an extra part of the project. And we've talked in the past, I had gone back to the board, I believe the previous quarter, and asked for additional funds to do things like some of the connecting work, the road work, things like that, things that were not included or were additional things in the project. For instance, the connecting corridor on the first floor. That was in the original project, and what Rudolph and Sletton built, there was a sidewalk there. There was nothing else. So we went back to the board and got approval for additional funds to build those things out. Excluded was still the back 40, and the number we had at the time was over $3 million for all that work. And we talked to the board, and they had said, let's cut that out because we may be expanding back there. Let's take that out of the project. So just to do the work that's going to go out there is about $1.2 million. And so we saved a couple $1 million in it.
Almost $2 million.
Yeah. And I went back to the board this past month and said, I think where we are today, I think I don't have to ask you for any more money for that $1 million. Even though it's not in the project, it's not in their contract, I think we're okay. So we're gonna cover that. So our numbers actually of what's coming through is going down, but there's a few things like this that we approved to try to take it in here because it looks like we have the money to do it. So I think that's trying to get your answer. In the last, even since this period, so from June 1 till now, we have about $1.3 million of changes that have come in. However, $735,000 of that is Rudolph's and Sletton's costs to finish the job, that takes them through January. So again, we're capturing that now. It's in our projections, and we're getting to the end. So it looks pretty good for us, seeing that, as Dan just reported, we're still showing at this moment, we're to the good in our contingency by about 3.7 million. So could we use it all up? We're not done yet. And you know how this goes. It goes on for about 6 or 8 months after we're done.
Yeah.
So it looks good. We'll obviously we're tracking it closely. But I wanted to get to that's the best way I can answer your questions.
Thanks.
Okay.
Okay, then looking at our funding sources, to date we have $291,983,000 of general obligation bond funds, including the interest earned. And as you can see, that interest line that Ed had mentioned at the beginning of the meeting at almost $2.7 million. So at this point, we have expended all of the general obligation bond funds. And the remaining $44.8 million of cost to complete will be coming out of estimated additional funding sources. A large part of that being the revenue bond fund, 2017 revenue bond funds that we're estimating at about $37 million. About $5.1 million coming from the hospital's fundraising foundation, and then $2.7 million coming through our specific purpose fund that we had on hand. So that is the estimate now to complete the project. Any questions on that?
So we're exhausted the geo bond issue.
Correct.
Okay. And then we issue another revenue bond for
We did, right.
for equipment or whatever.
Yes.
Where it was. And then we had some capital fundraising.
Correct.
We wrote some checks to the foundation
Correct.
Yes.
for that. And then the special purpose funds, 2.7. That's it.
That's correct.
Go over, the hospital has to pay.
Pardon me?
We go over, the hospital has to pay.
Yes.
That's correct.
So, congrats.
So the charge of this bond oversight committee is the GO bond, not the
Correct.
revenue bond.
That is correct.
But
You can't do one without the other, yeah.
Correct.
Okay.
Yeah. What is the reserves of the hospital?
somebody's
Do we have reserves? I mean, you probably got several reserve accounts, but.
Reserves relating to this project?
Well, I
Or
mean, you're gonna
to-
take money from the Washington Hospital reserves, that's what it says here, right?
Right. Well, actually, we're taking, we have the
Washington
revenue
Hospital
bond
Healthcare
fund
System.
the revenue bond fund was in 2017, so we had $38.5 million that we picked up for that. We also had the $5.1 million that the hospital fundraising foundation brought in. So those things, along with this specific purpose fund, cover the entire cost.
I think the question is, the 2707, that's really the balancing item on the sheet.
Actually, this is an item that's been with the hospital for several years relating to past projects that we were able to pull in for this.
Yeah, but I
They
think-
qualified for
I
this
think just on this
purpose.
spreadsheet, though, that's
Yes,
probably,
true.
that's the balancing. So
True.
those funds come from cash equivalents, whatever things
Correct.
you guys have.
Correct.
You have in total far more than 2.7 million.
Yes.
Does that make sense?
Yeah, I think the 2.7 is a real fund that we have in the foundation. So really, the balancing comes out of the revenue bonds.
Okay.
That we have the 38 million, and right now we're using 23. So we still have money that's available should there,
But you don't
they-
have
Shouldn't need
to,
a raise.
you haven't issued all of it, have you?
Yes.
Oh.
Yeah.
Okay.
According to the budget,
Okay.
they have $5 million slush right now between total expected cost and budget before we have to do anything, round numbers.
Correct.
Well, there's also that special purpose fund subsidy has a little more balance. Yeah, there's some reserves.
I don't care where it comes from as long as
Yes.
they have it.
It's just money. Cash is fungible, is what you're telling me, huh, Jack?
And you guys have it. So.
Yes, it was, we were anticipating needing that we knew that the general obligation funds were not going to cover everything. When we started this, as a matter of fact, you might remember when we first had a meeting, that was the main question is, does the hospital have the money that you're projecting you're going to need by the end of this job?
If they were $50 million with North funds, then we would be talking.
Yes.
That's right.
Have another campaign.
Okay, thank you very much.
Thank you.
Mr. Fan?
So we have the next meeting scheduled for October 17th.
Now, the only question I have for you, depending on where we are in this process, should we have this meeting on this date, or should we wait until we hit some
We have-
milestones?
There's an 18th of October coming up, isn't it? The day after, it's a magical date. Isn't that the date that you get the green light?
Oh, that's the 10th. It's-
Oh,
it's
the 10th, I'm
is that
sorry.
date.
I just
So-
didn't know if there was a reason to put it off or to schedule the meeting at this time.
Well, there's, you are correct, we're not gonna have a final accounting, so it would be more final if we put it off till the next quarter. How about if we say this, if we have anything that is a surprise or anything like that we need to report, we would have a meeting, but presuming everything goes as planned?
And give us notice 30 days in advance, is that
Yeah.
okay with everybody?
Yeah. Okay.
Okay, I make a motion that we delay the October meeting unless there is a reason to meet
Okay.
Second?
until such time as we are further along and we can make our final meeting.
Okay.
Can I just do that, or do we need an actual motion?
I think we have the motion and we have the second, so yeah, if we just vote on that?
Aye.
Aye.
All right.
Okay. All right, fair enough.
Good. Meeting adjourned.